Hi, my name is Crystal Patterson. I am doing subcutaneous injection video today. I have with me my patient, some gloves. This is what I'm using for my sharp container. I have the heparin vial. This is 10,000 units for 10 mLs. I have a couple of alcohol pads, some gauze, my hand hygiene, and then I have the syringe. So what I'm using today is a 25 gauge, 5/8 inch syringe, needle with a 1 milliliter syringe. For a heparin injection, you can either do a 25 to 27 gauge, and anywhere from a 3/8 to 5/8 it's needle, and it's normally a 1 milliliter syringe. I'm going to double check with the MAR to make sure that the EHR and the doctor's orders all match, which they do. The doctor has ordered 1,000 units, which equal 1 mLs of the heparin injection. Do subcutaneous, so everything matches up. So I'm going to go ahead and leave and come back in, knock on the door. The patient says it's okay for me to enter. I'm going to shut the door, provide patient privacy. I'm going to introduce myself to the patient, say, hi, my name is Crystal. I'm going to be your nurse today. The doctor has prescribed you a heparin injection. I'm going to explain what we're going to do, but first I want to ask you just a couple of questions. What is your name and your date of birth, and can I look at your wristband to make sure that we have the correct wristband on? Okay, name and date of birth are match. The doctor has ordered you a heparin injection today. I'm going to go ahead and perform hand hygiene, put on my gloves. A heparin is, it is a blood thinner. We use these to make sure that you do not get blood clots. So how it works is we're going to put, it thins out your blood in your bloodstream to where blood clots cannot form. Some of the common side effects for the heparin injection are excessive bleeding and bruising, and then some of the adverse side effects are dark tarry stools or vomiting blood in your vomit. If you have any of those, please let me know immediately so we can help you. Okay, now the first thing I'm gonna do is move it back and forth and go ahead and clean the vial. And, just like with any injection, there could be some stinging or burning at the injection site. Subcutaneous injections are normally done in the trash. They're normally done in the abdomen, in the thigh, or in the back of your arm. Today we are going to be doing it in your abdomen. So I'm going to put this down to 1 mL because that's what we're doing. So I can put that much air into it, and I'm going to take off the lid. The vial, pushing all that air in there, going ahead and pulling out the 1 milliliters. Tap it a little, make sure all the air bubbles are out. I have brought it out just a little bit further. Go ahead and push it back up to 1. Go ahead and remove it. All the air bubbles are gone. ahead, do the one-handed scoop method to get that back on. I'm gonna push it down. At this time, I'm going to check the abdomen. I'm going to check it for redness, swelling, inflammation, any kind of bruising, or any kind of wounds. I don't see any of that, so I'm going to go ahead and palpate it, see if there's any tenderness or pain, because if so, we need to pick a different site. And because everything's okay with it, I am going to go ahead and take out the other gauze. I'm going to go in a circular motion, starting from the middle and then out to about 5 centimeters out. I'm going to allow it to dry. Looks like it is dry. I'm going to take off the lid. I am going to put it at a 45 to 90 degree angle while pinching the skin. I did measure it to make sure that it has enough skin to give the injection. I'm gonna go to 45 to 90 degree angle, straight in, pinching the skin the whole entire time, and then pushing in the injection within 30 seconds, slowly pushing it in. This isn't a medication that we want to just push real fast. Okay, now that it's done, go ahead and take it off, release, get the gauze, go ahead and put it on the side, put the, dispose of the needle, take off my glove, everything's fine on that, take off the gloves, perform hand sanitizer. Thank the patient, put the patient in a comfortable position, put the patient in a space of comfort. Go ahead and give them their call light. Let them know if they have any questions to go ahead and give us a call. Thank the patient for allowing me to help them. Go ahead and document my procedure with the 6 rights. Right patient, right time, right route, right dose, right medication, and right documentation, and also if they're the right reactions, if there was any for the patient.